Sometimes when I talk about this in a setting like this, I can end up getting emotional. When we talk about dental anxiety, first of all, we all know there are just a million and one nerve endings in the mouth. The mouth, the oral environment is extremely personal and delicate. Obviously, people don't want disease there, problems there, and they certainly don't want a dentist messing around trying to fix something and potentially making it worse and or causing pain. So, given that, what we need to do, what I do, is set up an environment that is non-judgmental, and then I come alongside the patient emotionally as they're describing their fears, past fears, whether it be a medical or dental experience or some other traumatic experience. And I want them to feel heard and understood and not judged. And then I can offer solutions at their pace. And I think that's really important because everyone is at a different pace as to their ability and their willingness to proceed with treatment. Many doctors, when they come alongside a patient, don't discuss a personal situation, but I'm going to break that rule. I got stuck on a ski tram lift packed with about seemingly 40 people, and we were only stuck for probably 20 minutes. But my anxiety was about a 10 out of 10, thinking how we're a couple hundred feet up, I think, felt like. How are they going to rescue us? How are we going to get out of this? It's like 90 degrees inside this tram, but there's a blizzard at the top of the mountain. For patients to come into my office or any other dental office with significant dental anxiety is like asking me to relive that moment of being stuck on that tram. So I tell that to patients so that they could see I'm not judging them. I fully understand that what they're describing is a big deal. And then they need to see that I'm going to do everything I can to come alongside them and make it as comfortable as possible. I think one of the most dramatic moments happened about 8 years ago, and a man came into my office for the first time, called in with a really significant toothache. The man, as it turns out, is like 6'7" and weighs, I don't know, 250. I mean, I felt like a midget standing next to him. And he was swollen out to here. He hadn't slept in 3 days. He hadn't eaten in a day or two. And he was in an excruciating pain physically and mentally. And to top it off, he was unbelievably embarrassed about his anxiety. He kept saying how stupid this was. So just right off the bat, I said, no, this is not unusual. I see this kind of situation a lot. We need to get the infection under control. And I gave him a prescription for antibiotics, and I just created some drainage for the infection. And there was really almost immediate relief. So then he felt relieved, and then we could kind of talk further about his level of anxiety. And we just slowly made progress. I believe in his case, I gave him Valium for the next visit. And then we basically weaned him off that after about 3 to 4 visits. And I told him, you're in control. You are my boss. And I'll stand on my head for you if I can, whatever it's going to take to help you and come alongside. The problem with jumping to sedation, I mean, it's easy from my standpoint. Worst case, call in an anesthesiologist and they're just put out. But the problem is to successfully deliver dental treatment is a lifetime situation. That's not practical for the patient to receive a form of general anesthesia every time they have something done. So that's not my preference. I will use a drug like Valium in the beginning and nitrous oxide at times in the beginning. But I want them to realize that I'm really looking for our goal for them to be comfortable. And that means when they walk into the appointment and put their hand on the door of my office to come in my office, I don't want them nervous. That's our goal. And a lot of times when I tell an anxious patient that, they laugh like, oh, that's impossible. But generally, like 8, 10, 12 appointments into it, that is what ends up happening.